His Excellency, President of the Republic of the Gambia, Adama Barrow, on Tuesday presides over the inauguration of a clinical waste treatment plant in Farato in the West Coast region. The clinical waste treatment plant increases the safety of employees and patients by reducing the potential to sustain a sharp injury, along with the cost of direct and indirect treatment as a result. The correct clinical waste disposal also ensures the health and safety of staff, visitors, and patients who should be protected from dangerous exposure to medicine, contaminated equipment, and sharps. Speaking at the inauguration, President Adama Barrow says waste management is a bigger issue and that his government is ready to transform the country's health infrastructure.
Waste management is a big challenge for most countries. And it is a bigger challenge when it gets to managing medical waste. Poor infrastructure and insufficient waste management capacity make matters worse for many countries. Against this background, my government resolved to transform the health sector by modernizing the sector's infrastructure, providing standard equipment, and building human capacity. It is essential to have a solution to the worrying issue of medical waste. This would contribute sufficiently to reducing infection among health workers and the community at large.
Dr. Ahmad Lamin Samate, Minister of Health, says without President Barrow's quality leadership, the project wouldn't have been inaugurated.
Your Excellency, this edifice where you are going to inaugurate today, I think it's a big plus for this country. And we are very thankful because without the focused leadership, without the leadership that cares about the people, without the leadership that cares about the development of its country, without the leadership that is sensitive to the plight of the country, we wouldn't have been standing here today to inaugurate such.
The project is worth $5 million and is fully funded by the World Bank as part of their efforts in establishing environmentally friendly healthcare waste management in the Gambia. Mr. Axel van Trossenborg, the World Bank's Director of Operations, says crisis management is not the only requirement in the pandemic period, but also strengthening the healthcare system in general.
It is very important that we together think not only of the crisis management that is required in this pandemic period, but equally it's important to think ahead in how we can strengthen the health system in general. And here we have worked closely with the Minister of Health and his team to prepare an $80 million operation that precisely is focusing on a sustained improvement of the health system.
Meanwhile, Usman Bojang, governor of the West Coast region, says illegal dumping poses a serious health risk to everyone.
Illegal dumping of untreated waste in the drain system and at the outskirts of communities poses a serious public health risk for all of us. Thus, there is a need to put in place an environmentally friendly technology like this EcoTrail 250 series that we have here to enhance the proper management of clinical waste.
The World Health Organization says of the total amount of waste generated by healthcare activities, about 85% is general, non-hazardous waste, and the remaining 15% is considered hazardous material that may be infectious, toxic, or radioactive. Every year, an estimated 16 billion injections are administered worldwide, but not all of the needles and syringes are properly disposed of afterwards. Reporting for Kerr, Fatou, I am Landin Cisse.